Welcome to Fuzzybutts and Friends. Well, as much as it drives Fuzzybutts all over this great big world of ours absolutely crazy when they hear me say it, I am the host of this show, Luke Robinson, your big dog, and happy to have back with us this week our co-pilot, co-host, occasionally, most nearly every episode, Ginger Morgan. She's the executive director of the Puppy Up Foundation. Ginger, how are you?
I am doing well. I'm just looking forward to hearing everything you guys have to say today, and looking forward to the week ahead.
Indeed, this is an exciting episode. We'll get to that in a second. If you can see, I'm not in Fuzzybutt Studios yet again. I'm still up here in New York State, finishing up walk 3. So next week, I should be back in Fuzzybutt Studios, but we're able to do this remotely. And I'm excited, like you, Ginger. I'm also excited to have this week's guest because I found out about the Chi University in 2012 when I met Dr. Shea and had just a wonderful day spending time with him and learning about all the exciting things that they're doing. So this week's guest is Dr. Terri Rosado. She's a medical director of the animal hospital there at Chi University. Dr. Rosado, how are you? Welcome to Fuzzybutts and Friends.
Thank you so much for having me. I'm doing great.
Good, good. We were just talking a second ago because I used to know it as the Chi Institute, and I know some of our audience would as well, but you guys now are Chi University, so tell us all about that.
Yes, so I think it was maybe 2 or 3 years ago now, we became certified as a university in the United States of America. And so obviously changed our name to reflect that status.
That's wonderful. Well, I know you guys have been doing a lot of interesting, exciting research there. When I talked to and met with Dr. Shea, so I'm glad that you're finally realizing that vision. And also, when I was there in Florida back in 2012, there wasn't an animal hospital. That's a new addition. So tell us about that.
Yes, so I joined the team several years ago as a teaching assistant, and Dr. Shea asked me to come on board last year as the medical director for a new hospital. Currently, we are still building the hospital, slated to open in the fall of next year. A beautiful, it's over 9,000 square foot, 10 exam room, fully functional integrative hospital. So meaning that we are combining both allopathic and traditional Chinese medicine, as well as a full rehab facility. So currently we're seeing patients on a limited basis in our academic building, but we hope to be fully operational next fall.
That's exciting. That's very, very
Yes.
exciting. And
Thank
that's
you.
sort of the tent. It really is. Because I know a little, I don't know a whole lot about traditional Chinese veterinary medicine. But I've seen the results, and I certainly have met so many acupuncturists or veterinarians that have been to Chi University and have studied under Dr. Shea, and they're absolutely wonderful. And acupuncture is legit for companion animals. So we've got a lot to tackle today in this episode. Let's start off at the top, though, Dr. Rosado. Tell us what is traditional Chinese veterinary medicine in broad strokes, please.
Yeah, so broadly, traditional Chinese veterinary medicine, we call it TCVM for short, is the veterinary version of traditional Chinese medicine on the human side. It involves 4 different modalities. The most common, the one that at least we're most familiar with in the United States, is acupuncture. But there's also Chinese herbal medicine, Tui Na, which is medical massage, and food therapy, which is using food as medicine to treat the imbalance in the patient. There is a 5th on the human side, which is Qigong or Tai Chi, and that's the manipulation of energy within your own body. We can't really do that technique with animals, but I add husbandry and exercise and activity and enrichment as the 5th TCVM modality. So for me, there's a lot that I can do with my hands, but if we're not changing the environment for the patient, we're not going to get as far as we'd like to most of the time.
I was going to say that my fuzzy butt number 5, Grayson, would certainly try to convince you that he can do Tai Chi. Look at that right there. Actually, there he is. He's actually right there, crashed out on the hotel bed. I can can't really see him. He's
Very
He
snuggled
good.
blends
in.
in. He
Yeah.
blends in with the bed.
He certainly has the Zen thing going on here on
Yes,
the.
absolutely.
Well, that's a lot. And one thing, I sent you the talking
Yes.
points, and one of the things that I left off, one of the modalities that I certainly want to get to. So please don't let me forget it. I've got my notes here on a notepad, and I'm looking at my talking points on my phone. But food therapy, that's very, very important. And I spent some
Yes.
time with Dr. Shade discussing things like food temperature and that I found fascinating. But let's table that for a few minutes
Sure.
though, and start at the very top. Go down that list real quick again, all 4 of those.
Yes. Acupuncture,
Okay.
herbal therapy,
Okay.
food therapy,
Uh-huh.
and Tui Na, which is medical massage.
Medical massage. Okay, let's go with the first one, because I think that's something that you guys are known famously for around the world. I know you train tons of veterinarians every year at
Yes.
your location in Florida. So let's go over acupuncture first. Why is that? Talk to pet parents and talk to us about why that's important for companion animals.
So acupuncture can be used not only to treat disease, but to maintain balance within a patient in order to prevent disease. So in Chinese medicine, when we evaluate a patient from do our physical exam and obtain our history, a lot of times we can pick up on abnormalities before they're considered disease. And acupuncture can often allow us to go ahead and treat the animal in the early stages and prevent the impending disease that's about to occur. But we can also use it to treat a myriad of diseases. So it's the insertion of very small needles into specific points in the body called acupoints. And we choose those acupuncture points based on whatever's going on with that individual. So it's not just the disease itself, but how the disease manifested, the imbalances within the body that occurred that allowed the disease to take place. So with acupuncture, our goal is to bring the body back into balance so that the body can then expel the disease or treat the disease on its own. And most commonly, what people are familiar with acupuncture for is for conditions of pain like orthopedic disease or neurologic diseases like paralysis or seizures. But we actually use acupuncture for pretty much anything internal medicine related as well. So that could be cancer, it could be chronic kidney disease, heart disease, liver disease, very commonly skin diseases and other autoimmune disorders. So pretty much it runs the gamut. You can treat most things either with other modalities of Chinese medicine or in combination with Western or allopathic medicine using acupuncture and get a better response.
So then acupuncture then is seen sort of as a diagnostic tool as well. So I'm not sure if you know a lot about the Puppy Up Foundation, the work that we do there, but it's all about cancer and companion animals, and that I always want to dovetail all of our episodes to the extent that we can back into how does it help us with cancer companion animals. So then have there been scientific studies or do we have evidence of acupuncture as an effective diagnostic tool or precursor tool in cancer diagnosis?
Yeah, no research for it as a diagnostic tool. I will tell you that when I have patients come to me, and other acupuncturists have had the same experience, you have patients come to you for something completely different. And then we do our Chinese medicine exam. And sometimes, even though there's no outward evidence of cancer, just by looking at, for example, the tongue and the feeling of the pulse, it'll give us an indication that something more is going on. And there are very specific changes that can occur in the tongue and pulse of a patient that could be concerning for cancer. And so there have definitely been times where they might have just come in for a lameness because they tore a cruciate, for example, but their tongue and pulse indicated that I needed to go looking for cancer. And so I'd say, you know, I know you're not here for this. I know this seems kind of strange, but I really think we need to do an abdominal ultrasound or chest x-rays because I'm very concerned about what I'm feeling. And most of the time we do end up finding evidence of cancer in those cases. Not that that happens a lot, but certainly it's happened more frequently than could be explained through coincidence. But more often what we're doing is using the acupuncture to treat the cancer in conjunction with herbs and or Western medicine, which could be chemotherapy or surgery or radiation therapy or a combination. And there are a lot of research studies showing its effectiveness, particularly in humans treating post-chemotherapeutic nausea and decreases in white blood cell counts. And so it's really amazing as an adjunct to Western medicine.
That's wonderful. So then it's really looking at the dog. Let's just assume it's the dog that we're looking at as a whole then. And the acupuncture is one of those diagnostic tools that can help you look at the dog as a whole to determine whether there's some general malaise or there's some area of concern that requires further testing, correct? Is that accurate?
Correct. Yeah. In conjunction with the Chinese medicine exam. Yeah.
So let's start right there, actually. And look at that. What does a Chinese exam look like? Chinese medical exam look like?
So as an integrative practitioner, I always do a full Western exam as well, but then we go a few steps further. So our exam actually starts at the history, and we ask all the same questions that that a general veterinarian would ask, but then we talk about things like, how's your pet sleeping at night? Does your pet get up and pace? Do they pant? Do they have temperature preferences where you notice they're seeking out the sun, or they want to get under the covers, or they always seem hot even when it's not hot outside? What exactly are they eating and how much? And it's a very detailed history. And then after we've done our Western exam, we'll look at the patient's tongue. So we're looking at changes in the coat of the tongue. We're looking at the color, the size, and the shape. And then we're also feeling the pulses of the patient. So normally in Western medicine, we're just asking, can we feel the pulses and do they match the heartbeat? In Chinese medicine, we're going to take a couple of extra minutes feeling that pulse. And we actually use what's called a 3-finger pulse technique. And we're comparing the strength from one side to the other, how the pulse feels, how it feels from one finger to another. It's quite involved. And then the temperature of the body, the condition of the coat and the skin and the paw pads, the nails. It's quite an involved process. And then we put all of that together to give us our Chinese medicine pattern diagnosis.
That's a whole lot there to take in, and that's great. But the first question, what immediately comes to my mind though, is why is that not being done? And with Western veterinary medicine, and I know it's not being done because I'm on Fuzzybutt number 5, and I can't recall how many veterinarians I've seen in the thousands and thousands of miles I've traveled across the country. But they've never done all those things extensively, or most of those things they've never even done. But they do to a certain extent, and I like how you start the whole thing is history, because my dad was a nephrologist, a kidney doctor, and ever since I was a young boy, he always stressed the emphasis of diagnosis or diagnostics begins with a thorough history, and that's where most doctors don't delve deep down into. And he always gave this example of an elderly or a woman in her 50s, and she was a married couple, a woman in her 50s, and her blood pressure was spiking. She had ischemia, and they ran all the tests. Nothing was making sense as what was causing it, right? Well, after hours and hours of talking to her, they finally found out at night that she put chewing tobacco in her mouth and then went to sleep and slept with the tobacco in her mouth all night. And then in the morning, she pulled it out of her mouth and took it out of her mouth. Her husband didn't even know it. her husband had absolutely no idea that she did that. She'd been doing it since she was a regular nicotine user, tobacco user, and that was the cause. And so diagnostics was his thing. And so I fully agree with you that why is that though, Dr. Rosado? Why is history the most important thing? All the data points that you can give about a dog's external and internal environment, why is that not standard in Western veterinary medicine practices?
So it actually is taught that we should get a complete and thorough history. But at least in the United States, there are a shortage of veterinarians nationwide. And sometimes we have to choose, are we going to take the time that we need to get a really long history on this one patient, or are we going to try to help the next 5 patients as well? And so sometimes we have to make really hard choices with what's kind of referred to as herd medicine, where we're looking at the whole group of patients rather than the individual. And when you treat patients from a holistic perspective, which is what Chinese medicine is considered, we have more time to spend with the clients, and it's considered maybe inappropriately, it's what's the right phrase? It's an extra. It's not an absolute necessary in the mind of a lot of people. So, the veterinarian that just needs to get in and get out of the room, get the vaccines done, do the heartworm test, and move on to the next patient doesn't always have that time. Now, I will say, I've been doing this now for probably 15 years, and I don't always have time to get a good history either. So instead of sacrificing getting a good history, we send the owner a 1.5-page long history questionnaire that they fill out. And then our client care specialists are trained to read through that history, call the owner, ask them all of the follow-up questions that I would probably ask. And so all of that information is typed up and in the medical record before I ever walk into the exam room. So I already have a lot of information, and that's, I've just learned to do that over the years so that I can still provide the level of care I want to provide without having the time necessarily that we need to have to get that history. But it really is essential. And, you were talking about this woman chewing tobacco. I had a cat case several years ago that came to me. The cat was diagnosed with bone cancer in his hip, and based on x-rays, and the veterinarian had recommended euthanasia, and the owner wasn't ready to do that. So she came to me for a cancer consult. But because I was able to take the time to get a history, I learned that the cat had fallen when he was 2, he was now 14, and had broken his leg, and it had never healed correctly. So what the vet thought was cancer was actually just an old fracture that had healed in a very abnormal pattern. So I knew that this cat didn't have cancer, and we were able to move on and treat him for the things that he needed to be treated for. So that's just an example of where history is so absolutely essential. And I could probably spend hours talking about the necessity of a complete history. It really changes it. We have to get a little bit of tunnel vision when we're looking at these patients, but it helps to guide us to the correct tunnel as we go down. If we don't have a good history, we can't do that.
That's a wonderful story. I've heard stories similar to that. And we know, like, hemangiosarcoma is one of the most common ones where they think it's cancer. They euthanize the dog. Turns out the biopsy was negative. It wasn't cancer at all. And you mentioned about how veterinarians just don't have the time. Who doesn't have the time are dogs with cancer. And so, to me now, I was going to say that I understand a thorough history probably not required in 98%, 95% of the cases, because there's something that you can point the finger to that's causing the problem. We can see and look at it, but I stopped myself in taking notes and saying, no, that's not true at all, because Ginger and I both just lost a dog, Sadler, to cancer that came out of nowhere. Actually, we knew about it because there's this technology that detects cancer with a blood draw, PET DX. and we got the positive cancer indication from that test. But within 2 months, the cancer, we couldn't find the cancer anywhere. And then Ginger took him in for a second chest x-ray, and his lungs were riddled with lung cancer, and did an echocardiogram, had a couple of tumors on his heart. So one thing that I tell every pet parent passionately about, and I talk to veterinary oncologists all the time, is dogs can't communicate pain to us. They can't communicate when they're in the early stages of oncogenesis of the cancer process. So I have to amend my previous thought, even though I didn't get it out there, was that absolutely we need that thorough history and the thorough diagnostic examination process, because we are so behind the ball when a dog becomes symptomatic, like bone cancer disease is one. When a dog, it takes a dog to fracture a spongified bone on their leg before they show pain, right? And by then, as you know, most of the cases have spread to their lungs. So dogs with cancer we don't, time is so critical. So how do we, maybe I'm just throwing this out there right now, this might require a different tangential conversation, but incorporating the traditional Chinese veterinary medicine history diagnostic examination process, incorporating that and integrating that into Western medicine seems to be an imperative, right? Not a luxury.
Agreed.
To me.
Agreed.
Well, let us know how we can help. I don't want to, so we have so much to talk about. Just let us know how we can help with that, because clearly I'm passionate, and Ginger and I both, she's lost I don't know, maybe a dozen dogs to cancer. I'm all 3 dogs that have died that I've lost from cancer, and it's
talking about history. Even if you have if you go to the same vet clinic, the veterinarian that you see, because sometimes you don't always get to see the same one. I always request the same one, but they need to look back at the history as well. I took one of my dogs, Lily, in a couple of years ago, and I really thought her behavior was off. And so I wanted to get an ultrasound, and the vet examined her and said, well, I didn't feel anything. Do you still want the ultrasound? And I'm like, yes. If she had only looked back at the history, she would have seen that Lily had already had 1 cancer, 1 hematoma. I mean, why? The fact that she asked me, did I still want one? I just was like, duh, you know?
Right. Because the beauty of the ultrasound is it can see things that we can't feel.
Exactly. And Lily did have another tumor.
Yeah.
That I was, that we caught early. She was able to have surgery. She did chemo, and she just turned 15 years old. So
congratulations. That's wonderful.
Thank you. She's a mess.
Yeah. I agree with both of you. We need to all, as veterinarians, regardless of what modalities we do or don't use, we all need to be better at getting a proper history and looking at the previous medical record. My client care specialist can sometimes spend an hour or more getting medical records from previous vet clinics, because if I have a new patient coming into me, I want to know everything that has happened in that pet's life. There are so many things. There are context clues, like puppies that almost died of parvo. So many of them later on in life develop what we call inflammatory bowel disease or irritable bowel syndrome. If I know that they had parvo when they were a puppy, I'm going to go down a different path than if they had a perfectly normal gastrointestinal tract their entire life. And now all of a sudden they're 12 years old and they've developed GI disease. So it's not just about asking the client about lifestyle, but getting a complete previous medical history is absolutely essential.
Yeah, that needs to be standard of care, because another thing is that we look at veterinarians look at cancer still. Many veterinarians still look at cancer as a disease of old age. And we know that's absolutely untrue. I've seen puppies as young as 8 weeks get mast cell tumors, 6 months, lymphoma. A dear friend, longtime supporter of the Puppy Up Foundation, Signe Strasser, she just lost a burner to hemangio at age 5. So it's not like, somehow we need to incorporate the history and this holistic aspect of in the examination process as a standard of care year in, year out, every single year at the clinical level. Because again, the faster that we can see that there's some indication that requires additional diagnostics, that there might be a problem and it may be cancer, the better and more successfully we're able to treat it and we get a better outcome, as you know. So
Completely agree.
Whatever we can do on I'm taking notes. I always do, so I don't forget and also things to think about. Whatever we can do on our end to help make that a standard of care. Well, let's go on. That's acupuncture.
Yeah.
So so wow. So I would add kind of a fifth modality to that about traditional Chinese veterinary medicine is the holistic aspect, that you truly look more at the companion animal at the holistic level, the examination level. And to me, to know an organism, you have to understand the disease manifestation, you have to know the patient itself. So I think that's so important. So we've covered acupuncture. Well, give us an idea. I'm curious to know how big your acupuncture training facility has become. How many veterinarians have you guys trained now? A ton, right?
Thousands.
Right.
I think over 8,000.
Wow.
And each year we have another. Just in the United States, we have another 350 to 400 students come through. And now Chi University, I think, is in, it grows. It seems like it grows every month almost. I think we're in over 20 countries in the world now where they're getting their certification in acupuncture within their own country. So, every year it just seems to grow on a logarithmic scale. And that's wonderful, because veterinarians are looking for more tools, and they're recognizing that, when I talk to veterinary students, I'm telling them, when you graduate veterinary school, that is not the end of your education. It is the very beginning of your education. And if you stop trying to learn the day you graduate from veterinary school, you're never going to be a healer. You're just going to be always, behind the 8 ball. Absolutely. And so our goal is to heal.
Absolutely. That's a perfect segue into food therapy, which I'll get to, but I don't want to, I just have one quick question. Is the Chinese veterinary medicine examination using the extensive history, is that also a part of the training and education in acupuncture? Do you roll that up in there as well?
Yes, it is, because I spend a lot of time talking about it.
Good. That's what I needed to know. So every single veterinarian that I meet, Ginger, you do the same. Say, go to Chi University, go through their acupuncture training program for sure. So that's good to know. So let's go on to food therapy. It's a big thing. It's one that's touched me and one of my Fuzzybutts personally. And it's also, just as what you were saying, is that I have met veterinarians, veterinary oncologists all around the country, and every single one of them seem to say that they get 1 or 2 courses in diet nutrition. That's all they know about that involving companion animals. And it's just amazing that it's unbelievable to me. So let's talk about food therapy. What is Chi University? What do you guys do with food therapy?
So for food therapy in Chinese medicine, it's using the natural energetics of the food to bring the body back to balance. So at the most simplistic level, every food has its own thermal energetics. So the best way I can describe that, it's really how the food makes you feel after you've ingested it and the effects it has on your body. The easiest one to talk about is when you eat a hot pepper. The pepper itself is not hot from a temperature perspective, but the thermal energetics it creates within your body makes you sweat, makes your face get really red, makes you want to drink a lot of water. It is thermally or energetically a very hot food. Whereas something like watermelon, we love eating watermelon after we've been working out in the middle of the summer because it's a cold food. And even though we might be serving it at room temperature, it helps cool us down and brings back our body, returns body fluids to us. So that's the very basis of food therapy. But When we get into the more specific aspects of it, we also learn about what organ systems each food affects strongly. For example, something like strawberries and tomatoes, they enter the liver channel, so they can be used to help detoxify liver diseases. Whereas other foods might affect the kidneys more, particularly like beans, like our black beans and our kidney beans really help us to build strength in our kidneys. So each food can affect different organs in the body. They all have their own thermal energetic properties. And then they all have special properties, like we have things that help tonify blood. So if we have a patient that's blood deficient, the most extreme example of a blood deficient patient would be once we can see anemia on blood work. There are foods that we can feed them to help build up their blood that doesn't necessarily have anything to do with blood from a Western perspective. It doesn't have to be high in iron, as an example. But it stimulates the body to go, oh, hey, I need to nourish my blood. I need to bring it back to health. So we're just shifting the energy within the body and bringing attention to imbalances that are there using food.
So what types of foods would help with iron?
I knew that was going to be your question because you have a patient.
Yeah, so for iron, so that's a Western medicine question, but I actually love Western nutrition as well. And I think I do want to mention that when we're doing food therapy for animals, it's also very important that the diets are balanced from a Western perspective, because we can do all sorts of things with Chinese food therapy, but if, as an example, we're not giving them enough calcium, we're really doing them a disservice and creating another disease down the road. But foods that are high in iron, typically you would think of red meats. Liver is very high in iron, and the iron in foods is much more readily available than the iron that we're going to take in a tablet. So if you can give foods that are high in iron, that's going to be better than a shot or a pill. The shots really hurt anyway. Spinach is very high in iron. A lot of the dark leafy greens are high in iron. And again, they're more bioavailable. Our body can digest it better if it comes in its natural source in the form of food than if we're just taking a tablet.
Well, how would Chinese medicine, how would you treat or address a patient that has like a low hematocrit using food therapy?
So we have it's kind of a joke in Chinese medicine when someone asks us, how would we? The answer is always, it depends. Because there are a million reasons why an animal might be anemic.
Right.
And so from not only is it's nice to have the Western diagnosis, but from a traditional Chinese medicine perspective, we have to have that pattern diagnosis. We have to identify the imbalance that occurred in the body that led to the anemia or the low hematocrit. So from TCVM, the anemia and the low hematocrit are a side effect of the problem. They are not the problem themselves, if that makes sense.
It does. So pattern diagnosis is you look at basically the whole collection of symptoms or things that are going on to find the cause, what's causing the problem, correct? That's just it.
Exactly. So it is similar to Western medicine, but it's a completely different diagnostic philosophy. We're looking at why the disease happened. We're not looking just at the disease. And I really think that's where integrative medicine is so beautiful. We can look at both why the disease occurred and the disease at the same time. Sometimes, the disease is going to kill an animal or really negatively impact that animal's quality of life before we can address the cause. And that's where Western medicine is beautiful. It's great for emergency medicine when you need an instant result. But Chinese medicine allows us to get to the root of the cause and heal the body basically from the inside out so that the body can fight the disease. So if Western medicine can fight the disease and Eastern medicine allows the body to fight the disease, that's a beautiful marriage there. And the two of them together are really powerful modalities. I really try to discourage our students from leaving Western medicine behind when they come through and learn Eastern medicine, because using them together is just so important.
But I just think it's insane to look at them as two separate things.
I agree.
Why something happens, the root cause of something happening. This is the Eastern Chinese, but in the Western is how to treat it. Those two things absolutely go together. You need to know
They
what's causing.
do.
I understand
Yes.
that in an emergency type situation or cancer, let's just try to stop to slow the
Yes.
growth of the tumor, the advancement of the disease state. Let's do whatever we can to slow that down. I got that, but what's causing it is inevitably how to find an answer to.
It has to be addressed.
It has to be, right, exactly. All we're doing, and I do feel like this, and I don't want to get on a soapbox right now, but this is certainly a big passion of mine about and Fuzzybutts and friends in the future, is that right now in the world of cancer and companion animals, that's all we're doing is just treating cancer animals. We're not getting any further to trying to remove it from the population pool where the incidences are so high. Some breeds, as you know, 60-70% of every dog in that breed is going to get some type of cancer. That's not tenable. That's not tenable in the natural state, in the natural world. So if we don't find that why, all we're doing is just treating cancer dogs. And it's also not tenable from a resource perspective. You already have academic people saying stop treating dogs with cancer, companion animals with cancer, because if the number's right, we have 6 million new cases every year. You're talking about billions and billions of dollars of financial resources that are going to treat companion animals with cancer. I understand the argument. So it's absurd and almost insane to me to think that there are two different ways to approach a common problem, right? To a single organism.
Right. And if we do have two different ways of approaching it, why aren't we always using those two different ways together?
Right.
And that's the philosophical question I struggle with, because I mean there are very valid arguments for why are we doing all of these treatments for animals who are only going to have another 2 or 3 years of natural life anyway, using those resources instead of using those valuable resources for other things that we also need, like addressing our environmental issues or human disease. And where Chinese medicine excels is how we can prevent those diseases. So we never have to have that conversation. We never have to address the billions of dollars that are spent on that, or the ethics of what we're putting these animals through without their permission. You know, I know I'm probably getting on a topic that's going to get some pushback, but I think a lot of times in human medicine and veterinary medicine, we're focusing on saving a life, but what are we saving that life for? If there's not going to be any quality of life left while the animal or the person suffers the rest of their life before they die, which could be weeks or months or longer, we really should be questioning what we're doing that for and who we're doing it for. Because if we're not doing it for the patient, then maybe that's an ethical road we need to go down and explore further.
Well, I do think we're doing it for the patient because I believe in every life has inherent value, and the life of a companion animal, so long as it has good quality of life, is worth saving and extending. Even if it's just 6 months, 6 months to a dog that lives 12 years is what, 10% or 12% of its life, right? So that's it. But I call it, Dr. Rosado, I call it an N of one. An N of one, scientifically, as a scientific body, we need a big sample size, right? We need to look at a whole bunch. And I'm like, and yet, an N of one there's so much valuable information in that. This first dog I lost to cancer was bone cancer that spread to the lungs. The second one was nasal adenocarcinoma. And that one, I thought there was so much valuable scientific data and information, but I had nowhere to take it. There's no place to get that there. There's nowhere to get that data to. And so to me, like you just said, well, there we go. He's dead. That's lost. What did he die for? What did we learn? How did it extend our common body of knowledge that we can somehow prevent this or minimize the outcome or result when this happens? So you and I, wow, we could probably go on for hours and hours. But I want to get back. But I want to get back specifically to a case that personally affects me, and this is why I'm a firm believer in this, and it's great that we're having this conversation because I'm going to revisit this all again and do more episodes on this. But I can speak personally to the power of food therapy, though, because
Yes.
the fuzzy butt I just lost to mast cell cancer, Hudson had lifelong allergies. And the University and the research you've done benefited him his entire life because I didn't understand food temperatures. I can't recall, Ginger, when I diagnosed allergies. Hudson was an allergic kid. Let's just say he was always itchy.
You were still on walk 1.
That's right, yeah.
So it was probably in 09. One of the vet clinics that you visited actually donated that whole allergy testing thing, and as did the lab who processed it. So he came back with being allergic to eggs was the absolute number one thing, and eggs are everything.
Yeah, but he that's right. So he was 2. That's right. We had that problem. We actually ended up seeing multiple allergists and specialists and getting multiple tests. But his nickname was Itchy Scratchy because that's all he was doing. And so, but I can't recall what environmentally that the allergens he had environmentally, but what we did learn, which Ginger is speaking to, is that food was absolutely the number one cause of his allergy. And what I learned at Chi, talking to Dr. Shea, is about when you have allergies, the cool temperature foods are the ones you go with, like fish. And from that meeting and then forward, he was on fish for the remainder of his life. And do you know, even though he died of metastatic cancer, he was a 10-year cancer survivor. We've been pulling 10 tumors off him for years. And I believe that controlling his diet, that it didn't elicit that allergic reaction by using the cool foods. I don't have the science to demonstrate this or prove this, but from what I see, it changed his life phenomenally. Changing his diet changed his life. Wouldn't you agree, Ginger?
Oh yeah, absolutely. And if somebody, if we weren't looking and monitoring him and somebody fed him something he shouldn't eat, a treat, food, whatever, he got into somebody else's dish, it was an immediate reaction to that. And then it took that 4 to 6 weeks to clear it up again. It was, when we were out in public, I watched everybody because he was so cute. Everybody wanted to give him a treat. And I'm like, I have treats that you can give him. I carried treats with me, his treats with me all the time.
Yeah, and that's something that to me got me asking the question, and I don't think this is being looked at, is how do allergies, specifically food allergies, how does that play a role in mast cell cancer in dogs? And to the extent that I know, that's not being looked at, but it certainly raises a question, because I do believe there's a strong correlation between him being a lifelong suffering from allergies, and also suffering from mast cell tumors. I don't recall how many we pulled off of Hudson over his lifetime, but it was more than a dozen.
Wow.
Yeah, at least a dozen.
That's right. So that to me, so how do we, kind of break this down before we move on from food therapy, break it down simply for pet parents. How can pet parents learn more about food and the fundamental role it plays in the health and happiness of our companions?
Yeah, that's a tough question, because as you mentioned earlier, a lot of veterinarians have very limited education in nutrition. So as a veterinarian I'm not a I'm not a specialized nutritionist by any means, but as someone who has a lot of education in nutrition, I would want to say, talk to your veterinarian. But the veterinarian also needs to understand what their own limits are and how much education they do or don't have on it. There's way more misinformation about nutrition on the veterinary side than there is good information. And that's the difficulty, that we're taught to feed the same food all the time and never change food from, one manufacturer or one flavor to another. we're taught that kibble is perfectly fine and there's no reason why we can't just feed dry food to our animals for the remainder of their lives. To me, that logic sounds completely insane and is everything against what a human doctor would tell you. No MD on the planet would say, yeah, it's totally fine if you eat Cheetos as long as you're eating total cereal because it's got lots of vitamins and minerals added to it, and that's fine. We teach in humans that we should be eating fresh, unprocessed foods. But yet we're telling our pet owners the exact opposite. And there's not a lot of research in it, but I can tell you in the thousands of patients that I've seen over my career, diet and activity and mental stimulation are the three most important things that we could be doing for our pets. And I am not an anti-vaccine person. I do believe in appropriate use of vaccines, but I honestly don't think vaccination is nearly as important as feeding properly and making sure that our pets get the mental stimulation that they need for their breed or their breed composition or the individual, and the exercise that they need.
Yeah, it's amazing because I spent some time talking to a veterinarian who actually was a very, very well-renowned diet specialist in diet nutrition. And she gave me the article that dogs' GI systems had evolved 100% to the kibble diet. And it was perfect for them. And I was just amazed that was possible. I was thinking the kibble diet's only been around 70 years. And last time I checked, even though I'm not a scientist, seems to me that it takes evolution a lot longer to work for that. So the disconnect between, I guess, practicing veterinarians and their limited understanding of diet and nutrition is crazy to me, because we know garbage in, garbage out in any
Yes.
system, right? That's true of every single system in the universe. You put garbage in the system, you're going to get garbage out. And garbage out in terms of our companion animals, cancer. That's one of them. That's one of the end results of putting garbage into the system over a prolonged period of time. And yet it doesn't seem, Ginger, I've been doing this 15 years. My first dog, Malcolm, died from cancer in 2006, got on the road in 2008. And I have been thinking about cancer in our companion animals for a long time, longer than most non-veterinary, most lay people, probably every lay person. And it just amazes me that 15 years from now, I've been talking to veterinarians, talking to wonderful people like you, and we're still no closer to bringing diet nutrition front center in our discussion about the health and well-being of dogs. How is that possible?
I wish I had an answer for you. I will say it is on the radar much more than it was 15 years ago. And, Chi University is teaching a food therapy program where we combine Chinese food energetics and Western nutrition into a single course. And it's becoming a very popular course for the veterinarians that they all have to, before they take that course, they have to have a foundation in Chinese medicine. So most of them are already certified in acupuncture, but more and more veterinary students are asking these questions and realizing that it just doesn't make sense that we're telling people to feed dry kibble all the time. And you talked about mast cells, and that's a perfect example of cancer being fed by something like dry kibble from a Chinese medicine perspective. Mast cell tumors are energetically very hot. They're red, they're swollen, they increase and decrease in size, they ooze nasty, icky things when they get aggressive. And then we're taking food and we're adding heat to it, which is how most kibble is made. It's called a heat extrusion process. So we have then destroyed in the heat extrusion process everything that was naturally good about that food. We've added a ton of heat to it. And then we're going to feed that to an animal that is already energetically overheated. So we're just fueling the fire in those cases. And the same with allergies. Dr. Shea is absolutely right. Allergies are a heat condition. And when the first foods came out in Western veterinary medicine to treat food allergies, we talk about novel protein, novel carbohydrate source diet. So proteins and carbs that the patient has never been seen before. So the first thing that came out was lamb and rice. Lamb is one of the hottest energetic meats on the planet, followed very closely by kangaroo and venison. And these three are three of our primary food allergy diets that are then fed as dry kibble. So of course we're seeing more mast cell tumor dogs. And of course we're seeing allergies that never get better. You know, when we talk about testing for allergies and finding out what the animal is allergic to, that's very helpful in terms of how do we avoid it, or can we do immunotherapy? But allergies are an autoimmune disease. They are a failure of our immune system to recognize what should mount an immune response and what should not. And we're not addressing that on the Western side. We're just going, well, what are they allergic to? Let's give them a shot or some drops to make them not allergic to that anymore. But what caused the allergy to begin with? And that's a failure of our immune system or an overactivity of our immune system. And that's what we need to be addressing in order to avoid things like these dogs getting mast cell tumors later on in life.
How is it? Here's a business idea for Chi and Dr. Shea. How can you make that course that you're making available to veterinarian students available to pet parents? Or that's one thing that you guys need to be great if you could somehow take part of that course and take some of the science, the complex science out of it, and just trim it down a little bit and get it out there and make it available to pet parents. Because I know a lot of people would pay to see that exactly.
Yeah. And we're working on it. I'm actually working on developing a YouTube channel for Chi Animal Hospital. And one of the big things that's going to be part of that channel is food therapy for pets and what that means and how we should be feeding our pets from a wholesome perspective. So I'm hoping to launch that within the next year. It's a little busy right now as we're, building this hospital and getting ready to move in and all of that. But hopefully within the year, we're going to have a channel. And honestly, I'd like to make it free. I know that people would be willing to pay for it, but I'd like to disseminate this information as much as possible. I always find it a little sad that my income depends on animals getting sick, which is exactly what I would like to avoid to begin with. So I always say, if we can find a way to prevent disease across the board and that puts me out of a job, that's a really good reason to be out of a job as a veterinarian.
Yeah.
So
I wish that was said more often in your community, because when you look at veterinary oncology, it's a growth business. But yes, that's off the back of the three, Fuzzybutts that I lost to cancer and stuff, and it's an important issue. But I love that idea of trimming it down and getting a course that courses readily available. Because here's the problem: is that I don't know how many veterinarians there are in this country, probably tens of thousands, I would imagine, but there's probably 80 million households with companion animals. In the veterinary oncology community, there's like 500 and something, and there again are 80 million. So we kind of expect a very small community to trickle down a great deal of data or the relevant data to pet parents, or somehow push it up. It's not getting out there. So relying on the veterinarian community to get the information out to pet parents is just not working. So having wonderful organizations like the Chi University getting that, making that accessible to pet parents is critical. And it helps us too. So we'd love to have you. We're having a great conversation. There's so much to talk about, and I'd love to have you on more to talk about each specific things. And more importantly, as you roll out these, once you start your YouTube channel, let's get you back on. Let's talk about that. Let's break down some of these complex topics more in greater detail. Let's move on, though, to
Mhm.
the next one, the next modality on the list, which I find very, very fascinating and important. I think you guys are doing some wonderful research on, and that's Chinese herbs. What do pet
Mm.
parents need to know about Chinese herbalism?
Oh, so much.
Right, right. In 5 minutes, you got 5 minutes.
5 minutes, I can do it. So Chinese herbs are different from Western herbs in that usually Chinese herbs are prescribed in the form of a formula. So if there are multiple herbs that come to you in a single capsule or a bottle of granules or powder. And all of those herbs are put into that bottle to address a specific imbalance in the patient, not to address a Western disease. And I think that's very important because there are a lot of Chinese herbal formulas that are unfortunately available over the counter now. And there are two issues with that. One is, as an example, there is not a single Chinese herbal formula that is appropriate for all cats with kidney disease. There is not a single herbal formula on the market that is appropriate for all dogs with cancer. But yet that's how people are finding it on the web. So they're doing a search. They're saying, my dog has cancer. What do I give it? And they're giving an herb or a bunch of herbs that we don't know how they interact together. And they think that they're doing good when in a lot of times they're giving herbs that work from completely different mechanisms that are canceling each other out. And so they're actually either doing harm or doing no good at all. And across the United States, they're spending billions of dollars doing it. And so when you use Chinese herbals to treat any disease, it's very important that you're getting that prescription, the name of the herbal formula that should be used, from someone who is trained in Chinese herbal medicine and has put their physical hands on your pet, because nobody can feel a pulse through a video camera. So I'm not against telemedicine. I actually have an appointment with a client over the phone in half an hour, but it is a patient who I have had my hands on. And so I know a little bit more about what's going on. The second thing that I think is really important that clients should know about herbal medicine is not all herbals are created the same. Our government does the best they can, but they do very little in making sure that those herbs are pure, that they're safe, and what's claimed on the bottle is actually in the bottle. That is largely voluntary. So because these are not prescription drugs, even though I treat them as prescription, legally they are not prescription drugs, there's very little oversight. So if you're ordering something online, you don't actually know what you're getting unless there has been extensive research done, or you have asked those difficult questions of the manufacturer. How are you making this? Where are your plants being sourced? Are they being sourced responsibly? Have they been tested for heavy metal toxicity? And what's actually in the bottle? So the two main messages, just to summarize, is make sure that you're giving the right herbal formula, that you're not just grabbing some miracle cure. If there was a miracle cure, I would be out of a job, and all of us would be out of a job, which would be great, but there is no miracle cure. So make sure you know what you're actually giving and that it's been recommended by someone who's trained in that modality. And then make sure that the product you're using is what you think you're giving and is a very good quality product.
But it's a supply issue, though, again, is that
Mhm.
I agree with you 100% because I've seen so many pet parents out there that have a dog with cancer and they don't have the financial means to afford traditional Western treatment. And they get on the internet and they just do whatever research and they just start buying products that say they do this. And I remember speaking specifically to one pet parent whose dog had cancer and then started having labored breathing and some other symptoms and that were unrelated. And I remember talking to them like, well, how many different of these herbs and non-traditional treatments do you have your dog on? And it was just a huge list of them. I'm like, we don't even know how any of those things interact with each other or counteract or somehow cause all these a whole host of problems that we've never seen before. So the problem I see is there are not many veterinarians like you, Dr. Rosado, and that come from Chi University that can help guide pet parents who have dogs with cancer or other problems out there into making the correct choices and finding the correct suppliers of Chinese herbalism. So that's a big problem. So so telemedicine would be one solution, but what do you recommend for pet parents that want to learn more or want to work with somebody that knows more about Chinese herbs and how to apply them with their dogs and their problems? So how do you help pet parents?
Yeah. So I certainly see the frustration, and a lot of people just don't know how to find a holistic veterinarian.
Okay.
So there is a resource on the Chi University website that says how to find a TCVM practitioner, and you can just put in your zip code or your city, and you can define your radius of how far you want to travel. And it will provide you of a list of the veterinarians in your area that provide Chinese medicine and which modalities of Chinese medicine they are certified in. And I will say, there are a lot of veterinary acupuncturists who are not certified in herbal medicine, but have been doing a lot of their own education. And we do teach some herbal medicine in the acupuncture course. So at least start off by seeing someone who is trained in veterinary acupuncture. That's a great start. And Chi University offers free consultations to all of their graduates for the remainder of that veterinarian's career. So even someone that graduated from Chi University back in 2001 could email us today and say, hey, I have this patient with this kind of cancer. This is the pattern diagnosis, or these are my exam findings. I'm having trouble with my pattern diagnosis. What herbal formulas do you recommend? Clients can't do that because there are legal and ethical issues, but a trained acupuncturist can call us and we will give them that information free of charge.
That's wonderful.
For the rest of their career. Yes. So there are actually, it can be challenging to find, but there are actually a lot of veterinarians in the United States that are ready to help. So finding that resource, and also the American Holistic Veterinary Medical Association, the AHVMA, has a website as well where people can look for Western herbalists, Eastern herbalists, a lot of different holistic modalities there, homeopathy, if they want to go down that road. So there are a lot of options for people. It's just a matter of them knowing where to find it.
Absolutely. So, how big is the population of veterinarians that have been trained in TCVM? Would you say? Thousands. Good.
Yeah. Yeah.
Okay, so it's a fairly big population where pet parents can then tap into, right?
Yeah, so it's over 8,000 just from Chi University, but there's the IVIS, the International Veterinary Acupuncture Society, and there are other forms of holistic medicine that can also be used beyond just Chinese medicine. And a lot of those veterinarians are members of the American Holistic Veterinary Medical Association. So going to Chi University or the IVIS website or the AHVMA website is a really good resource on where to start and how to find somebody that can help you.
Excellent. Do you have are there a couple of, for the pet parents out there that do have cancer dogs or curious, do you have like the top Chinese herbs that they should consider or look into? I know it's a very broad question, but are there some ones that should be on the top of the radar? Hey, learn more about these ones.
Yes. So for cancers that tend to bleed, like hemangiosarcoma, there's a Chinese herbal formula called Yunnan Baiyao, which is traditionally used to stop bleeding. It was, I think it was originally formulated to help help save lives of warriors on the battlefields in China. But we have learned through a lot of research that not only does it help stop abnormal bleeding, but it also has very strong effects against cancer. So Yunnan Baiyao is a really important one. That's spelled Yunnan. Oh boy.
I think Ginger
Yunnan
has some actually, because when I think Ginger, did you not just
Yeah.
Yeah.
Baiyao. Yeah. And then there's probably the second most important is one made by Jingtong Herbals. It's not something you can get over the counter. It has to be prescribed by a veterinarian. It's called Wei Qi Booster. Wei Qi is basically part of our immune system. And Qi University is actually doing research right now, trying to identify the very specific active chemicals in that herbal formula that help slow down the progression of cancer and boost the immune system so that the immune system can fight the cancer. Because at the end of the day, cancer in itself is simply a failure of our immune system to recognize a mutated cell. We're actually, and I don't want to scare people, but we actually create cancer cells every day, all of us.
Yeah.
Our immune system kills them before they have a chance to multiply and spread. So cancer is just that our immune system failed to see it before it could, before those cells could repopulate and expand. So one of the very important aspects of herbal medicine is getting that immune system to wake back up again, to boost it so that it can start attacking the cancer. And Wei Qi Booster, through several studies, has been shown to be very effective at attacking cancer cells and boosting the immune system. And now we're trying to figure out exactly why that works. The third most common one is called stasis breaker. Again, this is one from Jingtong Herbals, and that is used to attack cancers. And both of those, the Wei Qi Booster and the stasis breaker, you have to get from a...
Oh, she froze. I'm frozen, I guess.
medicine. Oh, yep, you unfroze.
Okay, that was me. I'm Wi-Fi in a hotel, so my apologies to the audience. Normally we're on fiber, but I'm here at Red Roof Inn in Secaucus, New Jersey. Probably not the greatest Wi-Fi ever, so my apologies. Because you were saying something very important.
Yeah. So the fourth one, which is available, it's actually available online, but they've done some very good research to show their effectiveness, particularly again with hemangiosarcoma. It's called I Am Unity. It's I''M and then a separate word, YU Unity, YUNNITY, or it might be YUNITY. And that's basically a very concentrated mushroom formula that's really, really high in antioxidants. We don't fully understand how it works, but it's very high quality mushroom extracts. It's very expensive. It's cost prohibitive for a lot of people, particularly if they have a larger dog, because it's dosed by size. But when you're comparing that to the costs of radiation therapy or chemotherapy, it's more affordable. But a lot of oncologists on the Western side are actually recommending now Yunnan Baiyao and I Am Unity either instead of or in addition to chemotherapy for some of these cancer patients.
Wow,
so those are the top four.
How do I missed the name of the third one, but like the Wei Qi Booster, at what point does a pet parent, at what point in the disease state of cancer does a pet parent get that prescribed? When can they get that from a veterinarian oncologist, and how do they get it?
Yeah, so they're not going to be getting it from an oncologist unless they're also a Chinese herbalist.
Okay.
So this would be coming from your certified veterinary acupuncturist or Chinese herbalist. And we will start that or as soon as we suspect there might be cancer.
Okay.
Because it is so good. And the earlier you find cancer, the much easier it is to treat. And that's the same from the Western perspective, not just from a Chinese perspective. But so from a a Chinese perspective, this formula is actually used to treat what's called qi and blood deficiency. So we may put an animal on Wei Qi booster that doesn't have signs of cancer. They have evidence of qi and blood deficiency, which predisposes them to cancer. So we're not necessarily putting them on it directly to prevent cancer, but we're trying to balance the body.
So I would highly recommend pet parents, when there's even the suspicion you have cancer, go in addition to going to see a board certified veterinary oncologist, of which I am a passionate advocate for doing. Absolutely. It's worth the initial consultation for sure. You definitely need to go see a board certified traditional Chinese veterinary TCVIM. I always get acronyms messed up, but you need to go. Give us the website again, Dr. Rosado, where they can go at the Chi University, where they can find that information.
Yeah, so it's very simple. It's Chi, CHIU.edu. And then there'll be a link on there that says find a TCVM practitioner.
Excellent. Excellent. All right. I think that covers Chinese herbs. And I wanted to touch on real quick, because I'm interested, about the massage, and then we'll wrap it up as we're running a little bit long. So what can you tell pet parents about the fourth modality, and that's the massage?
Yeah, so massage therapy, and this is targeted massage therapy, again, regarding specific imbalances within the individual patient. I like to use it as homework. So not only might a patient come into our clinic and receive that massage, but I like to train the client to do it at home, because doing this massage, maybe even 5 days a week, can be of great benefit to what we're doing in the clinic, which could be prescribing herbals and or acupuncture, that sort of thing. It can stretch out the length of time that between visits, which saves the client a lot of money. But also the patients love it. They absolutely love the massage. And, you know, when we're dealing with our sick pets, a lot of times we get so sad because it just feels like we're shoving medicines in there, we're sticking things in their ear, we're doing things that they don't like. This is an opportunity to help heal our own pets by doing something that the pet actually likes. It builds on our relationships with our pets rather than tearing it down. And so I think it's a really important aspect of the human-animal bond that also helps heal the patient. So it allows the owner to have more buy-in with what we're doing and allows them to have a positive experience rather than strictly a negative one.
And it's also
Years ago, I had I had a lot of videos on the T-Touch, right? And so I was massaging one of my dogs with the video going. You know, I don't think I ever did anything quite right, but I was sitting in the floor and I happened to look and he was all relaxed. And I had multiple dogs at the time, and I looked over and they were literally lined up. You know, I had like 3 dogs deep, and I'm like, this is going to be a long night.
Yeah. Yeah.
Just patiently waiting their turn.
Like, it'll be my turn eventually. Yeah. But they love it.
We also know that in addition to the love and that enhances the bond you have with your companion, but it also is a diagnostic tool as well, because one thing that we passionately teach about here at the Puppy Up Foundation is lumps and bumps. You can never not have your hands on your companion often enough, because that's the way you find early, you find lumps and bumps when they're small enough, and other things as well. So I think that is it that I have to cover on my end. Dr. Rosado, is there anything else that's going on? Oh, I wanted to talk about research. So you're doing the Chi booster research, which sounds exciting. I can't wait to find out more about that. Is whenever you guys have any of your studies that you've completed, you want to talk about, Fuzzybutts and Friends is always a platform for you to come and talk about. I'm excited about that.
Thank you.
What other types? You're also endowing scholarships. What else? What other types of research do you have going on there?
Yeah, so through the World Association of Traditional Chinese Veterinary Medicine, there are scholarships and grants for veterinarians who want to do research in Chinese medicine. And it runs the gamut. It could be responses to acupuncture for everything and anything, the mechanism of action of how an herbal works or how it works compared to its Western counterpart. One of the very interesting research studies that's going on right now at Chi University is we're trying, not we, I'm not part of the study. The researcher is trying to figure out how to measure Chi. And Chi is basically our energy or our life force. It's the difference between an alive body and a dead body. And we have some ways of measuring electrical conductance through a body, but that's different than actual Chi. And so the one of our researchers at Chi University is trying to develop a machine that can actually measure Chi, which, if he's successful in doing that, is going to potentially revolutionize the treatment of patients through acupuncture and help us do provide better treatments to our patients, but also help with our diagnostic skills in identifying the imbalances and what we need to do to treat. And I think it also helps bring credence to traditional Chinese medicine if we can measure it. You know, Western medicine is all about research and proof, although I think anecdotal or experiential evidence is also very important. But it helps bring Chinese medicine into the Western sphere and say, okay, now we have the proof. So now we need to start, teaching this as part of veterinary medicine and not as something separate or additional to. So I'm really excited about that project.
It sounds really exciting.
It is very exciting. And you said that you're not on the research side, but you're on the animal hospital side taking care of the kids. So
Yes.
what was formerly known as Chi Institute, that you become the university and that you're becoming the whole package, the holistic package.
Mm-hmm.
You're not only training, you're not only doing the research, but you're doing the training and educating, and you're also now doing the treating. That's wonderful. Mm-hmm. That's something else. And you have inspired me to, in addition to both my Fuzzybutts, Indiana and Grayson, have wonderful general practitioner veterinarians I like and regard very well. But you have inspired and encouraged me to go find a TCVM certified veterinarian in my area to just go through the process. And also we'll be going through the process, and we're going to find some way to do a follow-up episode on Fuzzybutts and Friends as I take Indiana and Grayson through that process, because you're right, that TCVM provides that second crucial link to the medicine that's going on here in the United States, and that makes all the difference. So, Dr. Rosado, is there any other? We've covered a lot of ground here, and we're definitely going to have you back on to talk about some of the research and some of the YouTube channel and some of the things you're doing to educate pet parents. That's wonderful. Is there anything that we're missing that you'd like to share with pet parents out there?
I think you've hit on a lot of it, and probably all of it. To me, the biggest thing is prevention. If we can start feeding our patients right and getting them the right mental and physical stimulation, we're going to prevent a lot of these diseases from happening to begin with. And that just comes from, thinking about how you would treat your own kids. If we start treating our pets not as grandkids that we love to spoil so much, but thinking about not just the joy that they bring us, but also the responsibility that we have to them to make them as happy and healthy as possible, we're not going to need to have these conversations that you and I are having nearly as often. So prevention's the key.
Absolutely. And that's part of our mission here at Fuzzybutts and Friends, is how can we elevate how we value our companions in society? Because once you value something highly, as highly as yourself, you tend to take better care of it, and you think about things of how to prevent diseases in your loved ones. On that note, tell us social media or how to contact. It's Chi. What's the website again?
So for the university, it's ChiU, so CHIU.edu.
Okay.
And for the hospital, it's very simple. It's chi.hospital.
Hospital. And when will you start seeing patients again?
We are seeing patients now. We
Okay.
just don't have our hospital built. So we're not able to provide emergency Western services, surgery, general anesthesia, that sort of thing. But we're already doing rehab therapy, veterinary medical manipulation, which is similar to chiropractic, and all of the branches of traditional Chinese veterinary medicine. We do have some limited Western medicine. You know, we can do blood work and x-rays and ultrasound and that sort of thing, just not general anesthesia and surgery until our hospital's open.
Well, I'm looking forward to that, and I will certainly, if I can't
Me
make it out
too.
there before, I will make it out there when, I guess, fall of 2023, when hopefully you have your animal hospital opened up. I want to see it.
Please
I'm
do.
excited. It sounds like a wonderful, giant facility and a tremendous asset to Fuzzybutts all over this place. Ginger, have I missed
Thank you.
anything in today's episode? Did I screw anything up other than usual?
Not that I know of. One thing I did want to say is we usually have kinds of a cancer tip, but we've already talked about the massaging and finding lumps and bumps, which is one of the things that I'm always kind of on that bandwagon for finding lumps and bumps. But and we talked about a little bit about vaccines, and a lot of people are no longer getting their dogs vaccinated every year. And
Good.
I'm afraid, well, which is good. But I'm afraid then they also miss that vet visit.
Yes.
You know, so it's important, although your vet doesn't just do vaccinations. You know, they kind of do a heads and tails, exam of your dog on some of the things that you might miss. Some things like listening to their heart and getting their pulse rate and things like that, it's still important to take your dog to the vet, whether they're getting vaccinations or not.
Yes, at least once a year. And for our older animals, at least twice a year, because we want to catch those diseases before they get to the point where there's nothing we can do about it.
Correct. And you know what? If my dogs would just stay healthy enough, or maybe I'm a hypochondriac for my dogs, but my dogs are always at the vet for one thing or another, so they're getting checked out multiple times a year.
Yes.
Yeah, my recommendation is, I'm sorry about that. Go ahead.
I was just going to say, with prevention is, please stop having obese pets. Just stop overfeeding.
That's another one of my tips too, is, a lean dog is, an overweight pet, it just causes so many issues. Not only can it cause them to get cancer,
that's right. Yeah.
But you have hip and joint issues. So
yeah, it increases their risk of cancer, increases their risk of cardiovascular disease, diabetes. Everything that happens in humans, with the exception of clogged arteries, happens in animals. And an obese pet is not a cute pet. It's not cute. No. It's actually very sad, and it negatively impacts their quality of life.
Yeah, let's keep body positivity out of pets and this.
I'm going to take what you just said, that little clip, and just play it on repeat for my brother and his dog, because he constantly gives her treats. I'm like, what? I mean, she's not horribly obese, but she is overweight.
Yeah, well, we get a satisfaction from giving treats to our pets because they act so positively. But most of our pets, what they're actually wanting is that attention and that interaction. So rather than giving them a treat, play with them. It just takes a little more effort on our part, but they're just as happy getting that activity and interaction with us as they are.
I have one that wants the treats. Trust me.
There are exceptions. There are definitely exceptions.
Well, as we wrap this up, my recommendation to pet parents is, you have a great GP veterinarian. That's wonderful. They're so important in your relationship with your companions. But go out and also once a year, in addition to that, go find a TCVM, Traditional Chinese Veterinary Medicine certified veterinarian in your area, to get the complete picture, the total snapshot of the health and happiness of your companion, your mate in life. Until and when, Dr. Rosado, through the work that you guys are doing there at Chi University, hopefully the work that we're doing here at Fuzzybutts and Friends, that we can bring those two now disparate for whatever reason, bring those two together to have to get
Yes.
that complete picture. So, all right, guys, I think that does it for this week, this episode of Fuzzy Butts and Friends. I want to thank again Dr. Terri Rosado with the Chi University. She is just a wealth of information, and I look forward to having her back again on the show. Until next time, I should be back at Fuzzy Butts. Yeah, thank you. I should be back at Fuzzy Butts and Studios next week for the next episode. Until then, everyone, puppy up. Talk soon.
Bye-bye.
Thank you, guys.